I started life as a consultant haematologist in northwest London in Brent, and then I got sucked into the then new NHS R&D, joining a research funding committee of the region and then later chairing it. And after that became the Regional Director of Research and Development for the NHS. There was no remit for NIHR. I dreamt up the concept of the National Institute of Health Research, NIHR, and persuaded ministers that we needed it. We were not getting the best outcomes for patients because we didn't have the evidence, and nor were patients and the public involved enough in research so that the endpoints were right. So it stopped being Sally's idea and became the government's policy, which made it much stronger as we did all the changes which necessitating transferring money out of hospitals into a competitive system for trials or other sorts of research. And I felt we needed to move from what had become outdated into professionalising, in the first place, clinical research. The second thing I thought was, if the country is spending money on clinical research, then the country had a right to make sure it was high quality and relevant. So I was determined that we would do something which was new and different, but also that we could, if we have an NHS as a health system, we could integrate and interlock a health research system in order to maximise the impact on the NHS and the good for the NHS. NIHR was designed very carefully by me and the team so that you have an NHS and you overlay and integrate a health research system that delivers the training, the support and the funding to do the research that will make a difference for the nation, to the outcomes of patients, to the health of the public. NIHR was set up to partner. We partner first and foremost with patients and the public. It is there to support policy and ministers, but the partnership is not only with all the staff in the NHS and social care, but with all the academics in this country and how we work effectively with all the charity sector. We support industry and we deliver for them as well, and that matters. Where do our new ideas come from? Basic science. Where do our new interventions and diagnostics come from? Industry. But NIHR isn't just clinical trials and things. We set up a massive support network to look at clinical trials together, aggregate them, and do systematic reviews. Of course, the other thing I did was the Athena Swan Silver Award. So I said that people could not apply for some of the very big prestigious grants if they didn't have a silver award certificate from the Athena Swan that they treated women in research well and supported them. And that was massive in changing the support given to women researchers. And I'm very proud that we really helped women. There's some recent work which showed that for every £1 that goes in through NIHR, there's a return on investment of £13. But it's much more than that. It's getting patients into studies and public into studies where they participate and we get the best outcomes for them. NIHR is a research system integrated with a health system. I'm proud of how people have used it to deliver the evidence for better outcomes, but to take Britain to the top of the publication status in clinical research and the envy of the world. Setting up NIHR has been pivotal for this nation. We could see changes within 3 to 5 years, but as it's matured, it's made a massive difference. We as a team did something that really mattered, that has delivered and continued to deliver for the nation, and I feel really proud.